Here I am, guys. Here I am. DocSwiner has made it. I made it. Welcome. Happy Wednesday. Happy Wellness Wednesday. Woohoo, I'm on. Yeah. So I'm stressed out already. Thank you for inviting me. I am stressed out already, but we're going to be okay. Thank you for sharing, WebEV. Thank you for being so patient with me. Now my iPad doesn't want to cooperate. Hi, Beverly Bassett. Go Rice Girl. Joanne, don't fire me. Brenda 1073, welcome. It's DocSwiner. Here I am. We made it. So the iPad is wonky. Phone is wonky. Hey, lady, how are you? Wellness Wednesday. Stress hurts. Welcome. Stress hurts. So thank you for being patient. Thank you for joining me. I'm going to give y'all your extra however many minutes it took. So if you can stick with me, if you have some time, if you're at lunch, if you can just listen to us. Excellent. 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 So welcome. I'm DocSwiner, aka Dr. Nicole Swiner. I am your Superwoman complex expert, family doc, mom, wife, all that stuff. Superwoman in rehab, trying to balance these things like the majority of us are. And I thank you so much for joining PerigirlsTV, PGTV, Periscope, Perigirls being a wonderful group of now 11.5 thousand strong women on Periscope, helping each other, supporting each other, sharing each other's broadcasts, each other's goals and dreams and all that. And I am honored to be one of your Perigirls TV live broadcasters when I can get on. My day is Wednesday, which is today at 1:30 p.m. is usually when I start. Eastern Standard Time, 10:30 Pacific Standard Time. But we're going to make it work today, especially with our special guest. My first time with a special guest and whatever. But we want to talk about the Superwoman complex, stress. We want to talk about your muscle and joint issues, musculoskeletal issues that are related to stress, the most common. Hello, welcome, Eric Fredenberg. Hello, I see you guys. You guys are already doing a wonderful job with tapping your hearts and liking what we're saying, and then of course sharing sharing this broadcast on Twitter. Yes, Twitter and Periscope. Hey, PG Ninjas, who always has my back with my disclaimer. And here it is. Disclaimer. So I am a full-time family medicine doctor and practicing physician, but any of the things that we talk about, you want to make sure that you talk to your own physician, your own practitioner about, and make sure you get yourself and your history reviewed before trying any of these things, okay? But I talk about what I treat my patients with and what I do for myself on a regular basis and try to keep it safe and entertaining. Hey, Lumperito, one of my other wonderful Perigirl sisters. So let's get right to it. Stress hurts. We all, if you are of adult age, you are dealing with joint issues, joint aches. You wake up with certain things that you have bothering you. I know, for instance, I have my shoulder, my right shoulder is the one that likes to act up the most. I don't know if it was from carrying my babies. I have a 5 and a 3.5-year-old, carrying my babies, carrying a heavy bag. I'm on the computer all day long. It's my right side that likes to flare up. Sciatica on my right side. During these things, I share a lot about myself, TMI. Right-sided sciatica, probably during pregnancy, that was strained. I walk on a concrete floor at work all day long. So clearly, the older we get, the more joint muscle things, nerve things we have going on. A lot of these things clearly can be related to stress. It is what it is. So stress is, not some mystical thing, oh, you're thinking too hard, thinking too much. Stress literally can become physical. It can weigh you down. It can tighten your muscles. Hi, MKSA110. Thank you for joining. Thank you for sharing. Just getting started. Stress hurts. Stress literally can weigh you down like a weight. It can burden you. It can make your shoulders and your posture drop. It can become a chronic issue. So a lot of us are dealing with, how many of you, if you raise your hand, how many of you are dealing with tendinitis, bursitis, arthritis, chronic muscle neck tension? There's PG Ninjas. Yeah, I'm going to raise my hand. Yeah. Hi, Karen Myers, 239. Thanks for participating. Chronic headaches, neck spasms, Charlie horses, All of these things can be related to stress. So we're going to talk about the most common things that I see in practice, and how we deal with those things. So the most common things that I deal with on a regular basis, as a family physician, is I see a lot of joint arthritis, osteoarthritis. Osteoarthritis is the cartilage and the cushion between each of the main joints. So your knees, your shoulders, your spine, your hips, your feet, your ankles, your hands, joints in the hands. It's when bones start to touch bone and they grind when they move. So in between each bone, we have cartilage, we have soft tissue, we have fluid, oil in the joints. Over time, that can get worn down and wear away. So that bone on bone is touching. So that's what happens with arthritis. Your bones touch, they grind, they click, they crack, right? We're a lot of us are familiar with that. Your knees, as soon as you sit up, stand up, they pop a little bit, right? A little bit of arthritis. Your joint, that knuckle on the hand that you deal with the most, gets thickened, it gets swollen. From time to time, it gets stiff, hard to move. A lot of that is just, again, with time, with wear and tear, but it can get worse over time and it can be painful. Stress, if you're working more on your legs, on your feet more, doing a repetitive motion with particular arm, particular extremity, that's going to get worse, okay? So how do we deal with it? We can pop pills, of course. Tylenol, ibuprofen, Advil, take medicines for it. But there are some natural things that people try and have tried and have told me about and have been tested and proven to work. My favorite thing is glucosamine. Have you heard of glucosamine? Glucosamine. Glucosamine. It is a natural, there you go, PG Ninja's on it. It's a natural supplement. It usually comes in combination with things like chondroitin or MSM. Over the counter, you can get it at any over the counter place. You don't have to go to a special vitamin store. But what it does is it literally helps your body to replenish its oil in the joint. So, you can't regrow. Yeah. So apparently animals can take it too. Yeah. You can't redevelop cushion, but you can help the oil between the joints so that you bend and move better. Okay. So taking that every day, if you take it for a couple of weeks, up to a couple of months, it's supposed to really significantly decrease. Some people can have a little bit of stomach irritation, Brenda 1073. Glucosamine, PG Ninjas, can you pop that back up on the screen for me for Island Girl 53? Glucosamine, there you go. So I've had some people, so you would, it serves as to kind of increase oil lubrication. Some people have told me that it irritates their stomach a little bit, but not usually. My father swears by Joint Juice. That's a particular brand name that they sell at like Sam's Club, Walmart. Joint Juice has glucosamine in it. He drinks it like a little orange juice every day, and it helps his knees stay flexible. He plays basketball 2 or 3 times a week. So he's dedicated to it. You can take it in tablets, etc. Yeah. So that's something else. Does anyone else know about any, anti-inflammatory, any natural things for joints that you like to use? So glucosamine is one. It usually comes in combo with chondroitin, but you can also have chondroitin by itself. MSM, those 3 letters, also usually come in combination with those things, and they can keep them moving and flexible. Okay. The other types of joint things that I see a lot are some of the like autoimmune diseases. So, osteoarthritis is something, wear and tear over time, almost all of us. Glucosamine and chondroitin, that's right. So osteoarthritis is something that over time we all are, privy to. We're all, it's all possible for us over time for those joints to wear and tear. We got osteoarthritis in multiple places. And by the way, if you have osteoarthritis in one joint, aloe juice, good one. If you have osteoarthritis in one part of the body, you probably have it in multiple parts. Okay, so if you have it in the hand, you probably have it in the neck. If you have it in the neck, you probably have it in the knee. It's just the longer we live, the more of an increased risk of getting it. Aloe juice, WebEV noted, is another good one. I think aloe, vitamin E, all of those things are kind of lumped into kind of a anti-inflammatory, antioxidant category. Inflammation, that's what arthritis is. If you're unlucky and have it in your family history to have been born with the predisposition for things like rheumatoid arthritis, or lupus, which can also come with its own. Hi, Carrie Massage. Welcome. You came to see Miss Helen. I have a special guest, by the way, in a couple of minutes. I'm bring on Miss Helen to talk about some things. But rheumatoid arthritis, lupus can cause pain in the joints, polymyositis. These things that are genetic disorders, you generally will have a family history of them. But rheumatoid is different in that it usually does not affect Hi, Carrie Massage. It doesn't affect your body. You're either born with the gene or you're not. It's usually one or other of the smaller joints. So it's not going to necessarily affect you the same way that osteoarthritis does. Classically, it's in the hands. It's in the small joints of the fingers. And you may have seen how sometimes you can get a deviation of your fingers toward the outside of the hand. It's very devastating, but there are ways to control it. The glucosamines, the natural things, aren't as helpful. Usually you have to take higher powered medicines or physical therapy to help keep the joints moving, or see a rheumatologist specialist to talk about other types of injections and things of that nature. But, we have them. So get tested. There are antibody tests that we can test. There are, of course, when you do x-rays, you'll see things that are related to that. But, we control pain generally the same way. So medicines, physical therapy, massage, which we'll talk about in a moment. I, in practice, do a lot of steroid injections. Has anyone gotten a steroid shot before? Raise your hand if you've gotten a steroid shot. I've not, but I give them a lot. So these are joint injections into the affected joints. Instead of taking a steroid like prednisone by mouth, we're actually in a shot form putting it into the joint, where it is generally more safe for the body. Steroids can have their own side effects, but if you're putting it into the joint just where it's needed and not circulating it through the body, people tend to tolerate it pretty well without major side effects. So we use that. Massage is my favorite for chronic muscular tightness, tension, sore muscles, stiffness. Massage is my favorite. And I'm not just talking about, going to a high price spa. I'm talking about like a massage therapist, someone who's trained clinically to do massage, to release tension, to release lactic acid. That's a culprit, to help decrease cortisol in the bloodstream. Hands-on, touching, moving, releasing tension, major. So yes, massage. I love massage. So my favorite massage therapist here locally, Miss Helen Jimmerson Johnson, is here. And she's going to share some of the things that she does to help me and to help her clients reduce stress. She even has these little thingies. Who all watched the Olympics and saw Michael Phelps's scars he had on his body? It's from cupping. Cupping is an ancient Chinese therapy that she uses to relieve stress. So I'm going to have her come and talk. Are you okay with that? Can I invite her to come in? She's been waiting a while because we had technical difficulties. She's right here at the door. Let me let her in. You ready, Miss Helen? Yes. We had technical difficulties. Let me close the door. Welcome, Miss Helen Jimmerson Johnson, everyone.
Hello, how are you?
Look, Carrie Massage is on.
Hey, thank you.
So I want to back the phone up a little bit so you can see her beautiful face. Hi, PG just says hi. What baby says hi.
Okay, hello. I haven't got my glasses on.
Put your glasses on.
So I can, okay. Hello.
So this is my wonderful friend and my most favorite massage therapist, Miss Helen Jimmerson Johnson, and she brought along some cupping things. So briefly, tell people how important massage is for muscle relaxation, joint pain. How helpful is it?
It's extremely helpful. I got to hear a little bit of her talking about the stress and muscle tension, because in reality, if you was just to tighten up your muscles, and I know I'm exaggerating, but she's serious when it says it's hurt. If you was to tighten up while I'm talking to you, just tighten up like this, don't let go, let go. This is literally what's happening to your muscles every day.
Make myself slump down and relax.
Slump. So it really does hurt, because if your muscles are tight like that and they can't relax, it hurts. And when she was talking about cupping, as you all know, it was used in the Olympics. Michael Phelps used it, but it's been used for years.
Centuries even, right?
Centuries.
Ancient Chinese.
And I even found an article that said there was an early cupping that used animal horns to drain toxins and snake bites and lesions. And this is around 28 AD.
Oh.
And naturally, as she said, it's practiced in China and in Egypt. And then it was used for fever, pain, vertigo, menstrual imbalances, and actually it aids in healing crisis.
Okay. I'm going to get ready because she's going to demonstrate on me. I'm excited about that.
Yes, and the thing we want to put out is, I've done it on her. The cupping is not bruising. Bruising is from an impact. What happens with cupping is the skin, it starts to rise and redden, and the blood vessels expand.
It's like a hickey. I know that sounds horrible, but that's what it is.
Exactly what it is.
They say you're jelly. Go find your massage therapist locally, and they'll probably do it too. Yeah.
Right, but it's good for increasing blood flow, releasing toxins, and all what she was talking about with arthritis, the lactic acid. It gets rid of all that.
So I'm gonna let her show you what it looks like. Don't be jealous.
Okay. Now you won't see my face, but that's fine because I want you to see the cupping. That's the most important, and you need to see her beautiful face. She's a good woman. I'm just sorry. Go on and give her hearts. She didn't know I was going to say this, but she's very compassionate, down to earth.
I told you she's my
favorite.
Very
wise.
She's my
intelligent. So go ahead and just flood the place with hearts while I'm doing this.
I paid her to say that. Literally.
And so you just want to kind of warm the area up a little bit. Mm-hmm. And as you can see, I may do it kind of right here so you can see the mark. You don't have any shows or public appearance. Okay.
That's fine.
It's several types of cupping.
Because it will leave a little hickey for a couple of days, but it doesn't hurt.
Personal preference. We've got the lip, what we call the lip, and then the cup. Mm-hmm. And these are used also for facial, lymph drainage. And then the famous ones are the ones you saw with Michael Phelps, or the cups. These I have had biomagnetic use, so they works with your biomagnetic energy in your body. Mm-hmm.
She's trying to hide from the camera.
Oh, I'm sorry. She had to do a lot to get me here. Like, I already done went to the bathroom. I don't know how many times. And usually, and I'm using my left hand, but I want you to see, you'll place it in the area, and it's mainly where the muscles are, especially the belly or the origin and insertion. That's a little
tight.
No, I'm going to go here. Mm-hmm. This area is kind of what we call an endangerment site because of your carotid artery and all that. So it's a little close to that. And I want to get it where you can see.
We're trying cupping, y'all. If you're just joining us, welcome. Stress hurts, but this doesn't.
No, it doesn't hurt. And I'm just going to do one good pump. And as you can see,
it doesn't hurt. It's a suction cup.
It's a suction cup.
Yikes.
Some places actually do dry needling with it. I don't do it, and it works, but now that can be a little painful because they stick a needle in and then do the sucking. Mm-mm. But no, this is what happens. As you can see, is it's pulling up and everything, and what it's doing is pulling up those toxins, the lactic acid she was talking about.
Yeah. It's
draining all those anti-inflammatory chemicals that you need to get out your system. It's good for removing scar adhesions, breaking those up. Mm-hmm. And it can be left on 3 minutes up to 15 minutes. Mm-hmm. And as you can see, this is getting nice and red.
Carrie Massage says if you like deep tissue, you would like cupping. Yeah.
Yes.
It's helped my right shoulder a lot.
Yes.
It doesn't hurt, Brenda. I promise you. It sounds horrible, but it feels like a hickey. It feels like someone is literally sucking on the skin for a little bit. It does not hurt.
Right.
It does not hurt.
And if you've got major issues, I've worked with DocSwiner's for a long time because, like she said, she was carrying purse. Not only, but a lot of us women carry the purses. Trying to be superwoman, and we're not supposed to be. And it damages the right shoulder, and it can lead to damage in your rotator cuff. It goes up in here into your muscles also that causes stress.
Yeah.
So I'm not going to leave it on the whole 3 minutes, but I want it to get good and red. Yeah. And as you can see, just a little redness right in there.
Yeah. Just a little hickey.
Just a little hickey.
Yeah. And Brenda says, "Stop talking about me, Helen." Yeah. So I start, and I'm bad now because I'm actually carrying a purse again. But I started to just carry a briefcase so you can roll. So so you don't have to carry the heavy things. And I'm trying not to pick up my children all the time. What's hubby gonna say tonight? He knows it. He knows when Helen has been around. Because I have like multiple little hickeys around the back of my shoulder, so he knows when she's been around.
Yes, so we like to tell people, especially your significant other, spouse, or whatever, if they don't know anything about cupping, tell them it was not that type of massage. They can come in and watch it and experience it because, like she said, when you first see it, it looks like a hickey. You don't see the nice round, perfectly round circle. I'm sorry. She knows I'm trying to run from the camera.
I love it. It helps so that, sometimes if my shoulders and my muscles get tight enough, I'll start to feel it like radiating, like it's pinching nerves, like radiating down my arm. And it helps me. So don't be afraid to try it. Who was that? Brenda 1073. She was like, I don't know. Try it. So
Works
what other
wonders.
things do you use, like essential oils?
I can also use essential oils with this. I do use that based on the essential oil and what it's used for. Like frankincense is good for pain. Lavender.
Frankincense.
Yes. Lavender is good for pain and calming. It's just to my massage therapist, which you have to be careful using essential oils because I heard it will kind of mess with the rubber.
With the cupping. Okay.
Right. It'll wear it down a little faster.
Okay.
But not that fast.
If you're not using the cupping and you just want to rub sore muscles, what are good oils to use?
Lavender is...
Helen does need to be a Perigirl. I've been trying to get her on Periscope more. She's nervous. She doesn't know that this is actually a trick to slide her into the Perigirl. But what essential oils? What essential oils?
Lavender is really good. I use a lot of lavender. I use a lot of frankincense. Because remember, it was used in the Bible. Myrrh is also good. I use those a lot, and I've gotten good results with people saying it does help ease the pain.
Okay.
And also, I use DocSwiner's sleeping serum.
I did not tell her to say that.
No, she didn't. She didn't know I was going to say that. I've used it on a couple of people, and it really did help with the pain. They were able to really relax and to sleep, and it does help those that have our favorite peeing friend, Miss Minnie Paws, and you get hot.
Available at DocSwiner.com.
Yes, because I've used it, and even when I'm using it on the clients.
We should have our own show, really?
I've used it when I'm using it with other people. It actually helps me cool down, and I don't flash as much, and I'm not as hot. So
so my stuff it's a body butter, and it has lavender, it has evening primrose oil for the menopausal stuff. It has melatonin for sleep. I already said lavender. What else? Shea butter type stuff.
Butter,
so try it if you would like. DocSwiner.com. Talk to your doctor about it. But she likes it.
And even talk to your doctor about cupping because there are precautions and contraindications.
What are some contraindications? Who should not do cupping?
If you got blood clots, so taking medication for blood clots, because we prefer not to do anyone that has that, because massage can actually move the blood clot. And it can move it to your heart, to your lungs, or whatever. And
that's good.
I can't afford to be sued. I still have loans to pay.
How about pregnant people? Can pregnant people do cupping?
Pregnant people can be used, but I would use it with caution.
Okay.
And I would definitely talk with your doctor about it, because definitely if they have edema or some type of swelling, you don't want to use it.
Okay.
You don't want to use it. So as always,
the cupping, not massage. Prenatal massage is actually great, but just the cupping.
Yes, the cupping.
WebEV's asking, what about a stroke in the past? Can you do cupping?
Yes.
Okay.
Yes, because with a stroke, as I tell people when I say our first goal is to get the blood flowing, and I tell people I'm not saying blood's not flowing in the area, but it's not flowing as well. It's like if you're in a river and there's sticks and logs and stuff that cuts the flow off. That's kind of what happens to your muscles. So with massage, it helps open that up, get that blood flow going. So definitely with stroke, because they're not using their muscles.
She said you're one smart massage therapist. Loving you, Helen.
Bless your heart.
See?
Bless your heart. Oh, Lord, I really got nervous now. No,
keep talking.
Okay, let's see if I can bring that train back.
So stroke. So you can definitely do stroke massage for people who have a history of stroke. Can you do cupping for those who have had a stroke before?
Yes.
Okay, you can. Okay.
Yes.
Good.
Yes, definitely. Because they already have loss of muscle use, and that means the blood flow's not flowing well. So that would be a good way to get it flowing up in there for them also.
Yes. The other thing that I like massage for, can you do it with someone with diabetes?
Yes.
Island girl, if you want to fly her up to Canada, I'll come with her. And, you can just do a 2-for-1. So I'll come with her if you want to fly us. She said, can I, wish she were in Canada. Diabetes I think is a good, I have a lot of patients with diabetes that may have like numbness or just like to have, it helps promote blood flow. Okay. Look at Carrie Massage shouting you out. Massage Essence is Helen's company name, and you will not be disappointed. She is phenomenal. And if you pay her enough, she'll travel.
Yes.
And then I'll come with her.
Yes, she's got to come with me.
Miss Helen, what's your website?
www.massageessence, .com, and it's spelled the German spelling ESSENZ
massage.com,
but it's pronounced Essence. So I just wanted to have a little flair,
of course.
be cute with it.
There it is.
That's it. That's it.
Yes. Let's see what other question. Where in the we are in North Carolina, Island Girl 53, North Carolina. Let's see any other questions. So we've talked about osteoarthritis. We've talked about rheumatoid. We've talked about just general muscle tension, fibromyalgia. My fibromyalgia patients, very, very challenging disorder. Hard to treat. We have some medicine, some muscle relaxants, but thank you. Exercise is major. She doesn't do. I'm working on her, Beverly. She's a joint berry girl. Exercise is major for fibromyalgia, and then of course hands-on massage major. Fibromyalgia is when the fibrous fibrous ligaments and things with the muscles get inflamed and get tight. Trigger points, tender points, you need those things to be massaged and worked out. So for fibromyalgia, massage is excellent.
Excellent.
Okay.
Excellent.
Well, I don't want to hold you guys up. I know we went overtime because my technology didn't want to work. But I did want to give Miss Helen some time to introduce herself.
Thanks,
y'all. Follow her on social media. Massage Ashes. I'm going to try to bring her on more and try to get her on. Neuropathy. Can you do cupping with neuropathy?
I'd be a little careful.
Okay.
Depends on the area. I like to err on the side of caution. Medical massage is my specialty, so I was actually in the medical field 31 years and took that part with me. So there's some things I'm really kind of cautious about. I would do it, but it depends on, especially in the feet or areas. I would use more of the lymph drainage, because then it's a suction, but not a powerful suction. Because they need to know what they're feeling and how it's feeling to kind of let you know also, oh, that's too much or that's enough.
I see.
Because that's important too. Because some people like her, I generally use one suction, one pump. And I've got a few clients that their muscles are so bad and so tight because of what they do. I can actually do two, but their body can handle it.
Okay.
So
she's saying I'm a wimp.
No.
I only need one pump.
Most average person needs one pump. Really, that's it. That's it. Even Michael Phelps did one pump.
Just one
pump? You notice he just did one good pump.
Okay, good.
Yes.
All right, y'all. As you know, at the end of every show, I try to give you some options for next week. Thank you. Make sure to vote. So here are our choices for next week. Number 1, we can talk more about the Superwoman Complex next Wednesday, particularly the Sleepy Mama Syndrome. So if you like that one, put up a 1. If you want to talk about next month is Breast Cancer Awareness Month, of course. We can talk about breast issues. I've talked about mammograms and breast cancer screening, but clearly there are a lot of other breast issues that we have to deal with too. And then number 3, dealing with traumatic times. It's been very stressful with the election, with things going on in the community, brutality and all that stuff. So how do we deal with the stress of traumatic times and all that? So please vote either 1, 2, or 3. And what I do is watch the replay. I count up all the tally, and then I let you know what we're going to talk about next time, okay? And even if we don't get to one, next week, we're going to always talk about it the next times, okay? Thank you guys so much. Again, thanks for your patience with my iPad. I'm going to get it together one day with my technology. I'm so, so happy. Miss Helen, thank you for allowing us to be on as our guest. I appreciate you. I appreciate you guys. Find me on DocSwiner. Also DocSwiner.
I'm sorry.
On Periscope. I have my own channel, but I'll be back here on PerigirlsTV next Wednesday at 1:30. God willing. Bye. See y'all later.
Have a good one.
You did it, Miss